Hi, this is Dr. Saxena, and been talking on some of the issues which was related with intravenous vitamin C doses and all that. And we have been talking about the role of intravenous vitamin C in the present pandemic. Let me make you understand what is the history of this intravenous vitamin C and how it is absolutely can be a game changer when we talk about this particular stuff. I to begin with, I don't have any financial interest to disclose, and what I would like to take you back is Linus Pauling, as well as Evan Cameron. There was a big kind of a failure of there was a study which was done in New England Journal, which was in 1979, which showed that failure of high dose vitamin C therapy to benefit patients with advanced cancer. This was a study which was kind of much quoted study, and where see what happens was we need to understand what is this conflict about, how is this anti-ascorbic acid and the cancer treatment. I have to acknowledge here there are people who have done Riordan was the guy who has done kind of stuff, and when this study was done, people the effect was I'm talking about Linus Pauling, Cameron, Campbell. They started using 10 grams of vitamin C, and there were no blinding or placebo use, and IV was used 10 grams followed by the oral use. Whereas this New England study, which was done with 10 gram per day of vitamin C, which was orally used, it's not given IV. It was double blinded, placebo controlled. It was so this ascorbic acid treatment was discarded because of this particular study, which didn't look into the IV status. They just used that oral kind of stuff. Needless to say, when we talk about IV vitamin C, your plasma predicted plasma concentrations reach as high as 10 to 12 or something like that, whereas with oral it doesn't go up to that millimoles, so plasma ascorbic acid concentration doesn't go up. The kind of take what we believe is that the pharmacologic ascorbic acid concentrations kill some cancer cells but not normal cells, and this is a kind of prototype where they have done for cystic lymphoma cell lines, they have done for lymphoma cell. This mechanisms also was understood. The closed mechanism was understood was it's basically it was via hydrogen peroxide, and this particular stuff is you have seen multiple kind of steps. When we worked on this particular high dose vitamin C, we checked the dosage of vitamin C, which was 0.5 milligrams per gram. So if a 70 kg person gets something like 35 grams of vitamin C, and that was the kind of dosage we were talking about, because that dosage gives that kind of plasma levels of ascorbic acid, which can help in working with this killing the cancer cells and all that. Not just the cancer cell, we are talking about something like antiviral properties also. So this animal model, whatever things have been done, and we were able to replicate that in the humans also, and we tried to work with the kind of ovarian cancer, we tried with working with the pancreatic cancer as well as glioblastoma, and wherein we are able to slowly titrate the vitamin C dosage high above, and if we are able to get to that level, and there is a kind of good kind of remission which is happening post IV ascorbate, this one. So this is the kind of thing which I always try to tell this was a high dose vitamin C which has really helped, and it is the osmolarity which counts, it's the dosing which counts, because at least we need to achieve that plasma levels of to have that particular thing. And normally we try to add some of the nutrients, additional nutrients with the vitamin C, which can be something like magnesium. Usually magnesium I try to give it something like 200 to 400 milligrams of magnesium chloride with every 25 grams of vitamin C. And at higher doses, don't add vitamin B comp things and other nutrients. And for some reason we don't add glutathione into the ascorbic acid bag. We normally give glutathione separately after this thing is over. Uh, there's a good safety records and all that. Before going for this ascorbic acid infusions, we try to look at the glucose 6 phosphate dehydrogenase concentrations, and if the glucose 6 PD deficiency is not there, then only we are trying to work on this particular thing. And it's a very kind of the pharmacokinetics and all that are absolutely studied. We had worked on this particular thing. So my thing is, I would like to certainly go for this high dose vitamin C. And this high dose vitamin C helps not just in cancer, it helps in some viral conditions also, where you need to achieve that plasma moles of that high levels of plasma moles of vitamin C to get that biocidal action. Thank you.